good. Hello, my name is Jonathan Kalisa. Today I'm going to perform how to insert and discontinuing peripheral IV. So first I'm going to grab my supplies, have my IV 12 inches or IV extension set 12 inch, have my normal saline 10 cc. I'll be using a 20 gauge 1 inch of the IV catheter. I have my IV start kit, where it includes my tourniquet, alcohol swab, and my Tegaderm. A pair set of clean gloves and my sterile gauze. And this is my sharp container, which is I think it's just a sharp container. Anyway, so I have a 20 or 80-year-old male who going to be needing hydration. So before I proceed, knock the door, close the curtain for privacy, introduce myself. Once I introduce myself, I'm going to verify the patient's name and date of birth with the patient, and you can do the triple check with the wristband, and you can also do the MAR as well. After checking or verifying the patient's name and date of birth, I'm going to explain the procedure, what we're going to do. But before that, I'm going to wash my hands for hand hygiene. Place clean gloves. So this gloves is a bit too small. This is so hard. I tried to find a bigger gloves, but this is the only gloves that they provided. All right, so I have my gloves on. Now I'm going to inspect the arm that we are going to use. Let's say this is just a left arm that we're going to perform for IV site or IV insertion. Doing some observation, checking, make sure there's no bump, any discoloration, with a good site for putting the IV site. Now I'm going to grab my IV start kit, which includes tourniquet, tape, Tegaderm, and alcohol swab. So I'll grab my tourniquet here. Now I'm going to place the tourniquet in the patient's arm. Make sure not too tight, and about 4 to 6 inches away, or 4 fingers away, where we are going to insert the IV catheter. So once we have the tourniquet placed, we want to make sure we feel the distal pulse and a good visual for the vein. Once we got it, the pulse and a good side of the vein, we're going to grab the alcohol swab, toss in the garbage. So what we're going to do is we're going to clean the side about 4 to 6 inches away where the tourniquet is, and make sure we start from the center. We do some circulation motion clockwise. So from center, then outward. There we go. Toss it there. Air dry about 30 to full minute. While we waiting for air dry, I'm going to grab my normal saline and my IV extension. So what we're going to do, make sure it's not clamped. What we're going to do is we are going to connect this tube set into the normal saline because we don't want to introduce air to the patient. So we are going to prime the tube at least about 2 to 3 drops. There you go. Now we are going to lock the clamp with the clamp. Once you got it locked, now it's set aside. It's the skin is dry. What we're going to use is 20 gauge of IV catheter, 1 inch, 20 gauge 1 inch. Here, so I'm going to show it to you guys. I'm tossing garbage. So if I open this, I just wanted to show it to you. This is the bevel. Make sure it's up. So once we got the needle, what we're going to do, we are going to taut the skin or gently stretch it out. So we got a good visual of the vein. Once we get a good visual vein, we're going to anchor the vein, make sure they're not rolling or moving. So once we got the vein anchored, I'm going to place an IV about 30-degree angle. Once I get in, so I do have the flashback, or they call it flashback, or blood return, means or indicates that we have the IV catheter placed in the vein. Then I'm going to level a little bit down, slant right there, and then advance the catheter about 1/4 inch. After advancing the catheter, I'm going to push the catheter inside the vein. There you go. Once I place the catheter inside the vein, I'm going to place my finger to the my non-dominant hand to the IV insertion or IV site, and then remove the needle, retract the needle, toss in the IV sharp, release the tourniquet. But you see, I have my non-dominant place and secure the IV site or the IV catheter. Then I'm going to take my 10 cc of saline with the tube or with the IV extension here. So I'm still securing it. Make sure they're not gonna move. All right. After placing the normal saline, I'm going to unclump it. Once I get clump it, I'm still securing with my non-dominant hand. So we going to need some blood return. Once I get the blood return in, so we saw some blood, then I'm going gently to push the saline into the vein slowly. So once I got that in, so let's say I have my saline flush into the vein, and also we're still checking the side there's no anything infiltrated. Once I have that push or administer the saline, I'm going to lock the tube with this clump. So I'm still putting some secure on the side. This is harder than I thought. All right, and then I'm going to remove this, place it in the side, and toss in the garbage. Once I have that, I'm going to grab my non-tegaderm where I'm going to secure the IV site. So I'm going to place it here on top of the catheter. Go. Remove this the sticker. Then I'm going to use this where I put the information on the side. So I'm going to write down my initial, the date, and the type of gauge or the needle that we use. After that, I'm going to get the tape to secure the site. Here, I have the tape. That. So cut into half. I saw it in a video. Oh, no, we'll get a new one. Cut in the middle to half. All right, once I got that, I'm going underneath here to secure the catheter, the IV cat, the IV side. Cross, so we're doing cross here and then cross the other side. Also, I'm going to secure the chip on this side right here. All right. Okay, so got it ready to go. Take off my gloves, wash my hands. After I'm washing my hands, going to document, and that's it. Now, what we're going to do, we're going to get or discontinue the patient's IV site. So again, I have my clean gloves and my sterile gauze. So before coming in, knock the door, introduce yourself, explain the procedure, and you're going to verify patient's name, date of birth. Using two verification, we can use the wristband. Of course, we can also use the MAR. Before we proceed, I'm going to wash my hands. After washing my hands, putting in clean gloves. Next time I'm gonna buy bigger gloves. So once I put my clean gloves, of course you're going to observe the site again. See if there's any infiltration, any skin issues, any skin integrity on that side before we pull out. This is so hard that I thought. All right, I think this should be good for now. Okay, let's see. So I have my clean gloves on. So what I'm going to do, I'm going to glove a clean sterile gauze here. So I'm going to gently remove the sticker of the IV site. Gently go this side, then now we're using the clean sterile gloves. I'm going to put some pressure here on that side, then gently pull the catheter out. Once we pull it out, we wanted to observe the catheter, that they're still intact, still in place, that nothing has been anything that will cause the patient's harm. So make sure we double check that. Then we toss to the sharp container. After that, I'm gonna grab another sterile gauze, place the old one, the pressure, So when we put pressure at least 30 to a full minute until the bleeding stop, and then before we placing a new sterile, or before placing a new sterile gauze. So after placing the new sterile gauze, I'm just gonna get some tape to secure, or okay, here we go. There we go. Got it done. Then remove the gloves, wash your hands, then document. Thank you very much. Again, my name is Jonathan Calisto. I hope you like it. Thank you.